Assalamualaikum. We are KM2Z, but you can call us KM2s. And before we start our presentation, I would like to tell you a story. Mr. Kamru and his family lives in the village. They have a daughter, and he has big dreams for his daughter. He wants her daughter to grow up and get a proper education. But on the next day, what happened was, because he was working so much, he became ill. His wife told him, "How are you going to support your daughter, make her achieve her dreams, if you don't even live properly? If you get sick, if you don't survive, how are you going to support her?" So, recent statistics says that the life expectancy rate of Bangladesh and Japan is around 83 and Bangladesh is around 70. Why? What is the big difference? Because we don't live healthy. We do not live healthy, and hence we cannot live a long life. That's why the reasons are, we don't have proper food. Our food is adulterated. We don't have time, space, or energy. We work all day. A student studies in the morning and there's coaching, and he or she doesn't have time to exercise. Even a corporate or a government worker, they don't even have time to exercise. How are they going to live healthy? And also, we have this thing in our culture that when we get sick, even after all this, what do? We apply our own knowledge to buy medicines. We don't go to a doctor immediately. We go and buy our own medicine and use that. So, now we're going to talk about the problems.
So, I'll be talking about the problems in detail. For example, number one, that is food adultery, by which we mean that formalin thing we have. Basically, in Bangladesh, what we have this mentality that when we think of fresh food, we think probably that has formalin in it. We don't buy fruits from local vendors because we think that put formalin in it. So basically, the fresh word in Bangladesh is when we hear fresh, we mean formalin. When we think of formalin foods, so basically, what we tend to do is move towards packaged foods. Basically, buy fast foods because we think those are more safer than local fresh foods. That's what we think. Basically, that's what we think. And then we have lack of proper regulations, as my team member has already said, because people become their own doctors when they feel ill. They go to some pharmacy and they buy medicines without proper prescription. They don't know the adverse effect it has on their health. So basically, they buy their own medicines when they are not aware of the healthy things. So they don't know what adverse effects it has on them when they buy without proper prescriptions. And then we have lack of opportunities and equipment, by which we mean basically all over the world, the MNCs, they have some sort of events where they engage their employees with some sort of physical activities, where they exercise, they do yogas, they do this to keep them healthy, because sitting at the desk for hours and hours is not very healthy. It affects your health. But in Bangladesh, most companies don't do that. So that's one of the problems. Then we have lack of awareness, by which we mean most people are not very health conscious. Basically, in nowadays time, people in a family, both the father and the mother, they're both working. They don't have enough time to cook fresh, healthy foods for their kids. In a way, they move towards buying fast foods, which is not very healthy. So that is one of the problems. Then all these problems lead to the life expectancy rate, which is we don't live longer. That is declining. So basically, these are the problems that we found out, and I think it's going to continue with the solution. Thank you.
So this is our logo for our campaign. For the solution that we're going to put up is Shusto Jibon Dhara. So what it will actually hold, what it actually means will be is that the main aim for this campaign will be healthy living, which will lead to future sustainable society. What is a society if it doesn't have a future? If our children are already unhealthy and obese, what can we do to help them? That is the whole point. It is a long-term process, and we have to focus on the long-term effects. So to our solutions, as the problems has already been stated, I would like to come up into the regulations part, the government regulations. By that I mean the regulations in the pharmacies, the over-the-counter medicines that are provided. They are provided without any regulations. How many times a person uses it, how many times a person buys a certain medicine. It shouldn't be widely available because it can actually have other adverse effects in a society, such as hooliganism and stuff like that. But by regulations, I mean one solution can be that we can actually put regulations in pharmacies where people will actually have to present their national ID cards. They can put up their national ID cards and then have access to those over-the-counter medicines. And while they do, there will be a database where it will be recorded how many times they have bought it. So there will be a maximum number to be bought. Like within a week, they can buy it for. They can have a one-time purchase or within a 2-week purchase. It can be a monthly or a yearly limitation. Now onto the gym fitness training. Many offices, many large organizations or many MNCs actually hold these events where the workers actually get together to perform certain exercises. These actually help them with back pains because they are in front of a desk hours and hours. The next one is the compulsory PD classes. We do have PD classes, we do have physical maintenance classes in schools, but they are not official. We will make it official. These will be graded. Like a physical, a gym class. There will be a gym class where the children will actually engage in it, and they will actually have to be interested in it because it will be graded. The other one is the urban residential areas with gyms. We can actually assign or put up certain rules for when new residential areas will be developed in certain areas. We will put in rules where they will have to have at least one gym where people can go or have a fitness center where people can engage in physical activities. And the other one is the grocery store evaluation. We can actually encourage grocery stores to maintain and to see whether those are healthy or not, the food that they're buying. So we can actually have a credit system, like they will be rated on certain points. And the other one is the last one is the incentives for farmers. We will put out incentives for farmers. They already do not have much of government regulations, but we will incentivize them. We will give them more fertilizer and other facilities. Thank you. That's all for my part.
Okay, so this is a sample poster for our INC campaign. The slogan of our campaign is Sundor Jibon, Sunishchit Bhavishya. As we have said before, healthy lifestyle lead to a sustainable future. For our plan recommendations, we have some things. We want the government to make regulations for the city corporation to create family parks or picnic spots. It's not amusement parks. It will have health benefiting activities like cycling, space for cycling, like rock climbing, all the activities which engage in physical, maybe tennis, badminton, and it will be made by city corporation, so it will be accessible to the mass people. Assign fitness trainer to local parks. There are parks and fields where children play in Dhaka or other cities. There will be fitness trainers from the government who will help them to learn freehand exercises and also maybe yoga. Reduce taxes for high performance retailers. I would like to explain it. As she said, the retailer who sells vegetables and food will be rated. The retailers who will always sell healthy food will be rated as A grade, and they will get tax incentives from the government so that they always sell healthy food. For our implementation, we'll make TVCs as our, in our introduction, the story was mentioned. That's actually our idea for a TVC. We'll use the fear theme so that we can scare people to at least live healthy life. Then RDCs, we'll have radio commercials, we'll have activation events. This is especially for rural places where trainers will go and explain people what is healthy, what is not, how they should live their life. Basically to educate people because they are not much aware. And posters, as I have shown here before, this will be a poster, there will be other posters as well. One of the samples would be like for corporates. We'll have posters around the workplaces which will say, ride a bike to your work, it's healthy. Motivational posters. As time was limited, we couldn't know. Thank you.
Big idea.
It's a nice presentation. You are very good presentation. I like this presentation. But the problem statement, you were talking about people are not going to dispensaries. Like, people are going to dispensaries in case of if he's sick.
Without proper prescription.
Yeah, it is a problem.
It's a problem because they become their own. Basically, they become their own doctors. If they feel I have a headache or I have an apple,
Yeah.
so that we have to see on that because.
Have you ever analyzed this situation that why a person is going to the dispensary directly, not to the doctors?
They might think it's more time consuming and a big hassle to go to the
Probably
doctor.
the expense. We have to visiting expenses.
Sorry.
It's probably expensive.
In government hospitals,
Yeah.
the treatment is free, the medicine is free. So why they are not going to doctors? They are going to
I can clarify, it's actually the culture. It's been in our culture since long. Once, like, I went to a doctor, I got this is a headache, medicine for headache, I'll suggest it to my friends, my family, or you don't need to go to a doctor. The doctor will prescribe this. They always prescribe this. This has been our culture. So we, as we mentioned, lack of awareness. We have to let them know what are the adverse effects of taking the medicine from asking from your brother rather than a doctor. Culture.
Your problem statement, you mentioned the alarming life expectancy rate is a big problem. But I want to notice you that during the last decade, our life expectancy rate increased very drastically and very exponentially. And how do you explain this? Our life expectancy rate is increasing day by day. And I think this is not a big alarm for us. Okay. And how do you explain? And another thing is you mentioned the lack of proper regulation for the selling medicine for the retailer. We have a regulation. We have a regulation, a certain list of drugs they cannot sell without prescription, but they are not implementing in the field. But you didn't mention your recommendation or solution. You didn't address this issue. There is a regulation. We have a regulation. Only some sorts of most probably 17 items of medicine they can sell without prescription, but something like that. So far I recollect. And how do you explain?
So, the expectancy rate, it is increasing. Bangladesh is developing actually, but even though it is increasing, we will see that many developed countries are already facing these health issues. Like, let's look at America. It's a fine example. They're already having obesity at a very high level. So we're on that path of development. So we might as well look for it. It should be a way of prevention for us. So I mean, if Japan is also a developed country, but it hasn't it hasn't gone to a path where America has, where it has obesity at a higher rate than ever. So we don't want to be. We want to set an example. We want to make sure that as we grow as a country, we want to ensure that we don't turn out to be like how America's health issues have been. We want to ensure
but
that
we are living in a country. We cannot compare our country with America or Japan like that.
Yes, sir.
But we are not passing that time that we can compare the America or Japan. But anyway, go ahead, please.
And sir, about the regulation part, yes, there are regulations. They're not implemented. You are right. In order to encourage implementation, we have put out the national ID card and the data recording because people are not following them. There are many rules actually, but the people.
My question was very specific.
Yes, sir.
I agree with you. But why don't you mention in your recommendation or your suggestion this issue?
We were implementing with the
Yes,
national ID
yes.
card.
No, not. I don't mention the national ID card. This is your solution, but you must have given some solution. Can you
This is the recommendations time.
Yes, sir.
That yes. That answers. That's what he's looking for.
It was an honest.
Yes, you just say that about awareness generation.
It was an honest.
It's not. That's all you want to talk. Anyways, how much time did you get to prepare this presentation?
2 hours.
2 hours. Where are you from?
University.
Right. Something. If we start a presentation, I mean, should give some kind of introduction or something because I don't know where you're from. So, probably introduction might have helped. And about the basic concept of this presentation, I would say, you read the questions properly. What was the first task?
Ensure healthier food.
So, how can the government contribute to ensure healthy food and vegetable for citizens? Can you please show me how you have portrayed this problem in this presentation? Where?
Grocery store evaluation. So we evaluate and monitor.
That's my point. You have got a specific question, okay, which needs to be highlighted. Okay, what can be the government's role, okay, to do or promote this kind of activity? Because first of all, the problem statement had some issues, okay, because life expectancy had nothing to do with this kind of issues, okay. So we had, as you mentioned, that our life expectancy is going down. This is actually wrong because it's going up. At the time of medical innovations, in the development of the country, it's actually going up. So life expectancy is probably not the problem statement, something like that, nothing related. So probably you have chosen the wrong path to start with. Okay, Bangladesh has got lower expectancy than some of the developed countries, but probably life expectancy is not the key factor we will be talking. We expected you to talk here. So, and I would say the problem statement was you talk about the practices. How can you live healthy? Okay, then healthy food and vegetable for citizens. Okay, so the food practices, the food habits. Okay, it's kind of we wanted to see some kind of proactive campaign that would let people know that what are the things that you could do. Okay, rather than going to hospitals and stuff, that would make you live healthy. Okay, so we are talking about habitual development. Okay, so the awareness generation should come with habitual development. We've got some other aspects like what gym, fitness training. Okay, this probably is not. This is probably a secondary aspect that we might discuss. For a case like this, okay, we have had probably some more important issues that was actually left untalked. Right here.
Okay. We had one thing that the public will get free yoga practices. This would be given in parts and this would be given to the mass population.
Right. First thing, you have to be specific to your answers, to your questions. The first question was, what is the government's role? So you probably have not portrayed the government's role clearly here. You have probably one point about the government, but what is the government's specific role? Okay. You have not portrayed it clearly. That's one thing. And second thing is, promote proactive practices over reliance on whatever. It's probably here. But I would say some other aspects. Gym I've already mentioned. It's not something probably we are not seeing. It's probably a secondary thing that we'll talk about later. Then, whenever you give a solution, just think of the feasibility. You have proposed a solution about what? Tax rate, if I'm not wrong. Tax incentive for vegetable sellers. How many of the vegetable sellers of our country give tax? Or part of the taxation system of the country? How many of them?
We talked about incentives in form of products such as organic fertilizer.
Go back to your slide. Recommendations. Reduce tax rates for high performing retailers. That's what we wrote here. Okay.
Yes.
How many of the retailers or the vegetable sellers, that is just say who will sell vegetables or organic fruits or whatever, okay, they will be given tax incentive. In this system of Bangladesh, the taxation system, how many of the vegetable sellers or something are part of taxation? Many of you probably are not. I'm honest, right? So whenever you give a solution, think of the feasibility. Giving tax incentive is not something that's important here. But the point is, you have to make sure that these people are selling the right quality or hygienic products. You don't have to give incentive to them for selling that what they should do. Selling proper quality food is their responsibility, it's a duty. Okay. So you are giving tax incentive to a person, you are proposing tax incentive to a person for selling good foods. He is supposed to sell good food. This is the first thing. First thing is the proposal itself. The second thing, the proposal is probably not justified considering the taxation system of the country. So probably there are a lot of aspects that you could have covered. But just highlight a few things. Try to make use some brighter slide if possible, with some contrast fonts. That's actually better for our IPZ. Try to thought out, make a story. Should start off with the background. These what the problems are. Probably the story you started with. What was the three things you would find? You come up with the story, the background. Then suddenly you just use the background. Come with the background. Okay. Then read the question. See what you are told to do. See, you have to highlight what the government's roles are. So there should be a specific part where you have to highlight what are the things that government can do. These things. Then you can come up with a campaign that you say, okay, fine, now Shusto Jivan Dhara. Okay, fine. Then you're talking about campaign. Okay, then what can be the parts of the campaign? So probably you missed on entire aspect of the presentation of the question. The government's role. Anyways, good try. Hopefully,